Turns out feeling like you've lost your zest for life and like you're already past your peak isn't an identity crisis. It's just hormones. Hormones, people. Who knew? And men, you too. Pull up a chair. I'm Summer, doctor of physical therapy and integrative wellness consultant, and I'm sitting down today with my friend of over 30 years, Kristy Gonzalez, nurse practitioner out of St. Louis. And honestly, the fact that we're talking about cortisol, testosterone, and libido, nobody's more surprised than us. And listen, if your energy's off, your focus isn't what it used to be, or your workouts feel like they're going backwards, congratulations, because you're part of this conversation too. No filter, no fluff, just the stuff nobody talks enough about. So let's get into it. Tell us a little bit about you and your background.
My name's Kristy Gonzalez. I've been a nurse practitioner for roughly 13 years. I'm a mother of 2 little girls. I'm happily married to my husband, Drew. And I used to be in the Western medicine side of it. During COVID, I got out, and now I'm doing the more functional health integrated practice route. So
I love that. I remember when you were going through that transition, which we'll get into all of this because, as you know, I've been through the gamut of having to go to functional medicine providers for my own health needs.
Yes.
So yeah, I'm so glad that you made the pivot. And what kind of cases do you feel like you enjoy working with the most now?
My hormone patients, for sure. They come in, they're all different scales, but for the most part, they don't feel good at all. They don't feel like themselves. They're wondering what's happening, if it's in their head. Their doctors keep telling them, everything looks good. This is normal. Your labs are fine. And they're not getting the answer that they're looking for. So just seeing that transformation in them, it's amazing. So.
Well, and I know I've felt that difference, especially when I went through my issues and I was so young, so even more so the doctors were like, structurally, you're fine. Nothing should be causing any of these problems you talk of, right? But I
feel like you're making them up, but it's not.
And luckily, with working in healthcare myself, at least I knew to advocate and push and say, yes, but no. Like, I get that this test came out okay, but no, I still feel like,
That's what most of my patients say. I'm not typically their first encounter. And so they tell me that all the time. They've been seeking answers. Their primary, their OB, their endocrinologist, whatever it is, keep saying everything is fine. And then it starts to get in their head. They think something's wrong with them, or am I going nuts? Seeing that transformation is great.
Yeah, been there. And it's, that's why I love talking about this stuff. And that's a big part of my mission is
real world.
I just want people to know that this stuff is available to them and it's out there.
Yeah.
And a lot of it, unfortunately, but fortunately, is self-pay. So there's no gatekeeping, right? Like if you don't feel well, you can find a qualified provider, of course, have discernment, but you can kind of seek answers and solutions if you want to, even if you're told, no, you're probably just fine.
Yeah. It opens a lot of doors. Insurance sometimes inhibits you more so than, a lot of times, inhibits you more so than us.
Well, you've noticed that in your profession, and I've definitely noticed that in my profession in the recovery, prevention, maintenance side of things. It's like it really limits how much time and effort people even feel like they're allowed to put in because they think, well, if insurance doesn't cover it, then maybe it's not necessary.
Or maybe it's not okay for your body, or maybe it's not healthy, or it's, it's safer to do this synthetic or prescription route instead of going the holistic functional route, which insurance is. So.
Exactly. Yeah, it's important to remember insurance is a business like any other.
Oh, yeah.
So is healthcare,
One of the biggest,
Yes, and so is literally every facet of healthcare. And that's, again, what I just want people to have discernment and awareness around. Because, again, we know this working in the industry that, we hope that most people that get involved in these healthcare industries are caring, altruistic, wonderful people. But they're just people like anybody else. So sometimes there can be some not so great providers. There can be some more greedy based providers that are
Yeah.
just looking at the business side of things versus
Yeah.
the client
Yeah.
side. And so, yeah, just keep an eye out for all of it, I guess.
It's true. Yeah.
And so, what did your day to day look like kind of before you switched to functional when you were working the more
Oh
conventional
gosh.
side?
So I was working acute care. So I would see basically sick visits. I'm family nurse practitioner, so I would see all ages. And I was just treating, and I know everybody in healthcare sees this, but the same things over and over and over again every day. I was seeing about 30 people a day, sometimes more. Um, and it was the same thing. And I would see the same patients over and over because they just kept coming back. We would do the, recommended treatment and, it might work. A lot of times it didn't. And then they were repeat visitors. And I just got to the point where actually I came home one night and I looked at Drew, my husband, and I was like, I can't do this anymore. I'm not helping people. I didn't get into this for what I'm doing now. I really wanted to fix issues, make people feel good. And to put it bluntly, I wanted to do a follow-up call and have them say, when I asked them how are you doing? I wanted them to say, oh my gosh, Kristy, I feel great. Thanks so much. Blah, blah, blah. Everything's working. And that is very rare in what I was doing. So he said, just don't do it anymore. But that
Oh,
was
no.
scary because I had been doing this for so long
Yeah.
and change. I'm not great with change. So, but thankfully I found the practice where I am now. Everything works out I think there's a reason for everything. So God blessed me in that. And I found this job and yeah, I'm loving it. Loving it.
Yeah, it can be tough when you're in a position where, the interventions that you're providing, like you said, aren't giving you like the positive results or even like
Yes.
the I feel better or the thank yous or
Yes.
whatever.
Or they would feel better. Like I'd give them an antibiotic or, whatever. And I was making them better in that moment,
Yeah.
but I wasn't solving their issue. It was a
It's like
band-aid.
exactly. I was just to say it's like a band-aid
Yeah.
solution.
Yeah.
Yeah.
And we say that in our job all the time. Like, this isn't a band-aid. I don't want to band-aid it. That's a joke.
Yeah.
I want to like fix it. I want to tell you exactly what's going on and then go at it that way instead of, yeah.
Yeah. You want to get to the actual root of what's causing the issue versus just
Correct.
treating the symptoms. And same thing in
Correct.
my profession, which is why
Yes.
there's just so much overlap with functional medicine and,
Oh, yeah.
preventative maintenance based healthcare. And again,
Yeah.
it's so available to everybody if
I
you're
know.
just willing to try and be
I know.
open to kind of admitting what you're struggling with, you
Mm-hmm.
know?
Yeah.
And sometimes it's admitting it to yourself first and foremost.
Yeah. And relinquishing control. Uh,
Yes.
I think people go to their doctor's appointments and they take whatever they say as the Bible and they do, all those things and they're trying to do, and not that the doctor's not, they're wanting to help too,
Mhm.
but there's other avenues. You can do Western medicine, traditional medicine. You can incorporate supplements, functional health, hormone replacement. Most of my patients, they're still getting pap smears, mammogram. I mean, we've worked on all of those things. Um, but there's different things you can incorporate and add into your overall health plan to, combat everything from different avenues.
1,000,000%. And we'll talk about my big hormone disruptor, which was mold toxicity.
Oh,
What was it
that's
back in like 2019 or so?
God. That was horrible.
And speak of something and, simple ways that you can kind of have a positive effect on something like hormones, right?
Yeah.
There's so many lifestyle factors, whether it be
Oh yeah.
mold, environmental, or, products in your toiletries that can
Diet.
your
Yeah.
diet,
Yeah.
uh, all of that, your
Oh yeah.
stress levels, your sleep, all of that affects your hormones, right? So
100%.
yes, it's important to get the guidance, to get the proper instruction, but you also, again, there's so much that you can do on your own.
Yeah.
And it's just learning what's applicable to you and, you
Yeah.
know,
Well, that's true too. Most people, especially with the supplement side of it, we get a lot of people that come in and they think they need, you know, oh my gosh, some of them come in, they're taking they're taking like 15 different supplements and they have no idea why. They just watch something on Instagram or TikTok or whatever, and which is fine, whatever.
Yeah.
And, but then, we kind of narrow it down. And I feel like that's a problem for people too. They want to do it. They just don't know what to do and then what their body individually needs. So
exactly. Yeah. You can also over supplement as well and cause
and they're
other
not
types
cheap.
They're not cheap, so you're wasting your money.
Yeah.
Most often you're excreting.
Yes.
Because a lot of the times what people realize too, which is why it's so important to go to functional medicine, not everybody's absorptive processes are the same.
Correct.
So if you're swallowing a supplement, if your gut health is not able to absorb
100%.
that nutrient properly, you're just your money's
Leaky
going
gut.
right in the toilet, and you're not getting
my
the
hormone.
benefit. Yeah. So in that regard, there are injections, there are IVs, there are cream, there are other ways, right?
Yes.
But it's really learning what's necessary for you and what your own processes are. And I laugh because we've both been through it. I mean, you learn throughout your life, right? Even in the profession. So it is what it is. So
it's all about learning.
It is. And so, okay, from the physical therapy side of things, people and my own issues aside, right, with the mold stuff, my clients still would come in and they would see me and they would have all of these complaints while they're coming to see me for, let's say, back pain or whatever else is going on. But they would be like, God, I've had this bloating that I've been dealing with. It's just a stubborn little layer. Or like, how come one day my clothes fit one way and the next day they're totally different? Or you and I have talked about packing for a trip sometimes, whether or not you're going to be on or around your cycle. You feel like you have to bring a whole different wardrobe sometimes. Meanwhile, the labs can still say, you're good. Right?
Everything's normal.
So outside of the labs, what would you say is a sign that somebody should pay attention to that something's a little off?
Yeah. So that's a good question. Most of my patients, when they come to me, a big complaint that they've been struggling with, and they don't even necessarily think it's a symptom, so to speak. Sleep is a big one. So males and females. So I feel like that's something that starts to get off maybe first. Also, like joint pain or muscle recovery slows down. And mood. But but
that can be a whole spectrum of things, which is why I laugh. Like that can be the good things and kind of
or the not sleeping.
And the more manic feeling things.
Yes. All of it. Decline in drive, anxiety, nervousness. We deal with these symptoms all day. So
and when you mention the joints, like people,
it's a big one.
Again, it's people feel
and with your PT.
Yes, exactly. So that's another big referral where I'm like, you need to get your hormones checked. Right?
Yes.
It's like
inflammation. I talk about inflammation all day.
Yes. Oh my gosh, me too.
It is all day. Whether I'm talking to them about a supplement that I want them to take because of inflammation or diet changes that I'm trying to convince them to start, or hormone side of it. So like when we get in, which we will, I know, but like testosterone is a natural anti-inflammatory. So inflammation is the big one. And I get people all the time, I've got 5 pounds, I've hit a plateau, I can't lift 5 pounds. Well, a lot of that could be, not necessarily always, but inflammation. So, it's a big one.
Yeah. And I feel like that comes up just so often for people. And then sometimes there's also the layer of with inflammation. And again, with my situation, it was like the whole process of needing to kind of detox before you nutrient yourself, right? For lack of a better phrase. But so that kind of plays a whole role in it too. Like you can get backed up on your internal hormone balance because your detox pathways are blocked, right? So again, it's just more layers to pay attention to and more reason to talk to a functional provider who's able to test and look at these different numbers and levels of things, right?
Right. Well, and when a patient comes in for us, they fill out, and you actually personally.
Yes, I did.
I know. So they fill out a form, and it's a symptom check, one of the forms. It's a symptom checklist. And I don't know exactly, I mean, I could count them off and memorize. It's roughly 15 or so symptoms. And at the very bottom of the page, it asks about, do you have daily bowel movements? Do you have bloating, abdominal pain after eating, different bowel, GI, gut questions.
Mm-hmm.
And my patients will ask me, well, what the heck does this have to do? Like, why do you need to know about that? But I tell them, if you have any of these symptoms, it could be a sign of leaky gut. And if you're going to pay for hormone replacement, and we're going to want, you're paying for it. So we got to make it work. And then B, if I give you hormones and you have leaky gut, you're literally going to just lose those hormones, like what you're paying for. It's going to do that.
Yeah.
So for those patients, we always start a probiotic and different things like that. But we ask about gut. First day they come in.
Explain for people that might not understand the basics of leaky gut. Can you explain what it is and, how the inflammation can play a role? And that way, because I feel like people are may listen and assume that it means like literally leaking from your gut.
No, just leaking those minerals, hormones, vitamins.
Yeah, it's more.
You're not absorption. Yes, you're not absorbing them as you should be. And it can be for multiple reasons. We offer, gut testing in our office and, parasite testing, bacterial testing, all of those things, fungal, like you experienced. And that would be like obviously a more severe case. Most of these patients coming in, they have minimal to moderate symptoms in that avenue, and we can correct it with the things that we're offering with anti-inflammatory diet, the hormone replacement, probiotics, prebiotics, greens, fermented supplements, so things like that. But yes, I mean, if you have issues like that, I do highly recommend going to a functional doctor, getting gut testing, parasite tests. All of those things can help so much.
Well, and this next question might be a little bit skewed because, again, people are usually coming to you when they've kind of tried all of the other things, right? And they've kind of experienced the normal lab plague, but still not feeling well. So I would say, how often, if you can determine, how often do you feel like people are told that their labs are normal, but really there's something there to work with?
100%.
Yeah.
Like every patient that comes in, and I hate to say that because it sounds made up. Yeah.
Very often.
It like over 95% of patients. Yeah. They'll come in.
In your industry, people are coming to you usually
Correct.
because they've reached that point.
Correct. And we do some testing that the primary or even endocrinologist or even an OB doesn't check. So we kind of get more into the nitty gritty of it with the blood work panel that we do. It's a pretty thorough test. But yes, patients come in all the time. And the first thing I say to them is, oh, are you excited to go over your labs? And most of them say no.
Yeah.
I'm like, oh, okay, well, we're going to go through it. It's not as bad as well, that's because, and it's because they've been having these tests done over and over, and they know something is going on. And everybody that they sit with, if they get to sit with them, sometimes it's just via email, they get an update that, oh, everything looks great, looking good, take vitamin D or something. Well, so a lot. Most of my patients hear that, and they get very frustrated. And I've had multiple patients where they come and I'm like looking at their symptoms, I'm going over their labs, and I just look at them and I'm saying, now, doesn't this make sense? And, it's not just in your head. There is a reason. And I've had multiple, more so women, but they will break down, they will start crying because they've been struggling with this for 15 plus years. And, sometimes it's affecting marriages, it's affecting family relationships. And women more so take that on. We just say, oh, I just have to deal with it. This is just, I guess, what it's going to be.
Being a woman too.
And I'm going to just get over it. And so they feel that release, like, oh my gosh, okay, yes, let's fix it. I'm ready to fix it.
Yeah, it's validating to have somebody be able to objectively recognize and kind of mirror back to you what you've been feeling and
Oh, yeah.
symptomatically, right?
Oh,
And I
yeah.
mean, it 100% affects marriages and relationships and even how people perform at work, in
Oh,
terms of your
yeah.
ability to even focus or
Oh, yeah.
mental
Or
clarity.
snapping at coworkers,
Yes,
not showing up to work.
and again, your sleep, like all of
Yeah.
that affects your
Yes.
ability to do anything, really,
Yes.
you know?
Yes. Hmm.
Um, so talking about sleep quality, can you explain a little bit of the basics of kind of, what, let's say, a period of consistent poor sleep can do to your hormone levels and what kinds of effects people could see and how long that might take?
Oh my gosh. Yeah. So, because sleep, so there's difficulty falling asleep. These are the two main that I deal with day to day. And obviously there's different issues, but most of my patients, they have both. So, or one or the other. So they either have difficulty falling asleep, and this is male and female when I'm talking about this, but difficulty falling asleep, or they fall asleep fine, but then a lot of, especially my women, they'll wake up between like 3 and 4, 2 and 4. They
Witching hour.
every night, yeah,
That's
every
what I call
night.
it.
God, it's horrible. And I personally had
It's
this.
like the spooky time to wake up and you're like,
Yes,
do I
I
get
know.
to
And
get
I
out of bed?
read this. I don't know if this is true. Anyway, but, but it's like a Chinese thing. The 4 o'clock. It's like a cursed time.
Well, but okay, what I thought you were gonna go with it is there are body clocks, like organ body clocks that
Yeah,
are like
well, that too.
certain
No,
but there's validity
literally,
to
I had
that.
a patient tell me this, and she would wake up and she was Chinese descent, and she would wake up every day at 4 a.m. and it would freak her out. Anyway,
I mean, like I said, 3 AM to me is the witching hour. That's why I was like, "Ooh, it's the
yes,
spooky time. I don't wanna be awake at
yes,
that time."
yes.
Oh,
So,
that's funny.
and then their brain, especially the women, their brain starts going, and they can't turn it off, and they start worrying about things that is just, I mean, ridiculous things. You're never going to fix at 3 a.m. Or they start worrying about things that aren't even controllable. It's just not realistic. And so what I tell those patients is that a lot of that, most of that is hormone and diet too, but a lot of it is hormone related, specifically with sleep, specifically testosterone and progesterone. So for those patients, depending on their scale of severity, I would recommend both of those. And I'm just saying this from personal experience, night and day. So, you start hormone replacement. 3 weeks later, I was not waking up anymore. I was sleeping. And the
Yeah.
first morning it happened, I was, no, something's not right. Because I got a full night's sleep and I had,
I've yeah,
yes,
been through some
yeah. It's like when you have a newborn and they sleep through the night for the first time, it scares you. But
that
um,
would yeah.
yeah, and it was just because I hadn't slept in years, and that's a lot of my patients. They're just used to it. They just function on zero sleep, and then they're supposed to be, a lot of them are working full-time jobs, and they're mothers or grandmothers or whatever, and they're expected to do it. They haven't slept in like sometimes like 20 years, 15 years.
Well, and even outside of just the sleep, men and women, like getting your hormones in check and balanced, you just feel like a totally different person,
Oh my
like a
gosh,
calmer person, a more centered person in general. And this is what I've heard across all ages, across the board,
all ages.
regardless of, why you needed your hormones dealt with in the first place, right? It's
Yes.
just
Oh
like
yeah.
there's so much in terms of even the little urges you feel with your hunger and,
Yeah.
or like, your energy levels. It's literally everything, and your
Everything.
focus and your interests or
Focus is a big one. Yeah, which I
yeah.
didn't mention, but yeah, focus, brain fog, memory, concentration,
Yeah.
especially in my patients that are like postmenopausal or my, late 50s, 60-year-old male patients, even 40s now, but memory, it's freaking them out. And they think something, they're like, oh my gosh, I'm too young, I'm getting dementia, or they have family history of it. And so that plays a big part of it because they're like, oh my gosh, this is it. Like it's happening. But no, most of that is low testosterone. So when I check their testosterone levels and I see, oh my gosh, well, you're female, let's say their testosterone's at a 20. Cool. Yeah,
Mhm.
your brain is not going to be functioning great. So we increase that testosterone level and yeah. It's crazy. It's like a light switch goes off when it kicks
Yeah.
in,
I
the symptoms.
mean, yeah, it really is pretty crazy
Mhm.
how fast all this stuff can happen. And even thinking back to when I was at the height of my mold toxicity stuff, it's like the symptom that had me at my breaking point was the memory issues. Like,
Yeah.
and because before that, I had the memory of an elephant and I could, especially
Oh
with
my god.
remembering
Very
numbers.
annoyingly so, by the way,
Yeah, but
for you.
even
It annoyed
especially
me.
with
Your memory was
numbers.
so good.
It's bizarre. It
Always
it's
has been.
very bizarre. But yeah, that
Yeah.
was the most limiting thing to me because especially when you are younger, let's say in your 30s and 40s or even your 20s and
Yeah.
physically you're able to kind of push through a lot of the discomfort and a lot of the fatigue because you're
Yes.
just like,
True.
whatever, I have to get to my job, mind over matter,
True.
keep your head in the
Yes.
game, right? But I mean, you should really pay attention, right?
Yeah.
So,
And it's scary. I feel like some people are scared, right?
yeah.
They don't know admit that, "Oh my gosh, I go to the grocery store and I can't remember what's on my list." Or I run into somebody that I've known for
Mhm.
20 years and oh my gosh, what the heck is their name? I can't recall it. And that's scary. And
It is.
so I think that they're scared to tell somebody about it. But then when they tell me and I say, "Oh, well, that's why," they're like,
Yeah. Well,
"Oh
and
my
even in
gosh."
even when people are younger and they're working, it's like you don't
Yes.
wanna admit like, "Oh, I forgot to put that memo on the calendar, and therefore this
Right.
didn't happen," right? Because then you
Right.
look like
Um,
a bad employee. You
yeah.
more yeah, I mean, but yeah, again, it's
But
like
it's true.
it's all avoidable for the most
Yes.
part, right? And so what would you say
Yes.
is the first sign if you could tell people, "Gosh, I wish you would have come in to see me X amount of time ago when you noticed this first thing," what would you say?
Ugh. Um, okay, well, the first thing that comes to mind is libido,
Ooh,
energy.
that's a big topic.
For my females, mood and
Mhm,
sleep is a big one, early one for females. And this is kind of a side note. Well, okay, so males would be muscles unlike they used to.
mhm,
That's a big early sign. Energy for them, muscle recovery. And then a big one also would be feeling like past your peak for males. They just don't feel like they used to. And they feel off. But again, a lot of the males are like, I don't really want to admit that kind of a thing. And then, it gets to a point where they come in and they seek help, which is good. I wish they would just come in right away.
mhm.
But I tell my female patients all the time when I mentioned mood and sleep for them early on, because I think, and this is just me saying this, there's no proof of this whatsoever. But if so a lot of my female patients between the age, let's say 35 and 40, late 40s, 48,
Mhm,
a lot of females go to their OB. This is so common. They'll go to their OB or their primary, but a lot of times OB. And they'll say, I'm not sleeping and I'm feeling depressed, but it's not like I'm depressed. I just don't feel like I did. I don't feel right. My mood's off. Well, what did they get? They get Xanax,
Yeah,
Cymbalta,
yeah,
Ambien,
yeah.
Trazodone. And they say, okay, here you go. And they take it and they take it and they take it. And then fast forward 15, 20 years, they still can't sleep. Their mood is even worse. They're taking their trazodone and they're taking their antidepressant and anxiety, but they already went to their doctor and talked to their doctor, and that was the fix. So then, well, what do I do now? Kind of. So I run into that all the time, and I just tell them if they would have just checked your hormones at between 35 and 45, 48, 50,
Mhm.
a lot of it is just hormones. And they could have just replaced your hormones if they do it the right way, safely. And you aren't on trazodone and you don't need Ambien and you aren't
Mhm.
depressed. Maybe you don't have estrogen like you did or testosterone or whatever. So,
Yeah, the body
uh,
changes.
yeah,
Well, and
yeah,
sometimes the environment changes what's going on in our body, even the climates we live in or whatever, right?
100%.
So
Yes.
it's yeah, and
Plastics. Yes.
yeah, well, and even I mean, I've noticed a huge difference in how my body works from living
Being
in
in
Chicago to
Florida.
now being in Florida.
Yes.
So it's, just going to say, get these things checked every now and then, right? It's never
Yes.
like a one and done. Your body changes, your life phases change, like the
Fast.
world changes and the toxins in the environment change, right?
100%. Yes. Yes.
Like,
I could check a lab, and I see that a lot. Like, I'll check labs, and then, well, I'm checking labs all the time. But
right.
for example, let's say a patient comes in, they don't want to start hormones yet. We check their labs. They don't want to start hormones. Fast forward a year, 2 years, whatever, almost a year. The same lab, same tests done,
Mhm.
but let's say their testosterone was at a 60, which is still low. Like,
Mhm.
yeah. And now even a year later, it could be down to 20, 15. I mean, it's not, yeah. So get it checked because it can change fast and their symptoms are only going to get worse.
What ages would you recommend that I know you mentioned, like, especially the 35 to 40 range, it's for women particularly, but for men and women, ideally in a perfect world, if let's say insurance, self-pay,
Yeah.
money
Yeah.
grew on trees, let's say,
Yeah.
what would you recommend people do at what ages in terms of starting to assess?
That's a good question. It depends on the patient. So if the patient if let's say she's 35, she feels awesome, periods are regular, she's got great libido, she's sleeping like amazing, her mood's, she's fine. Don't, whatever. But if for example, I have patients in their early 30s, they have been through the hormone. Oh my gosh. So, hysterectomy at early 30s.
Yeah.
They have PCOS, endometriosis. Everything's been off for them for so long. They're finished having kids and they come to me and they just say, do it. Like, I just want to feel like myself again.
Mhm.
So they're in their early 30s and I'm replacing their hormones and they feel like they did when they were 20, you know?
Yeah.
So it just depends on the patient. For males, I would say anytime they start feeling those symptoms. Now, in general, what I've noticed trend wise is very early, low hormone levels. And it's it's really scary. So these males and females that I'm checking in their 20s, and they're coming in typically for more functional medicine. In our practice, we check labs on everybody. So anybody who comes through the door, we check labs on it. Um, for the most part, but most people we get labs on. And the reason is because we're integrated and we want to know if we're treating, your back, but
Yeah.
if your inflammation markers are high and your A1C is high and your hormones are low, we need to address all of those things. So these patients come in their 20s and their hormone levels are rock bottom.
Mhm.
And why? I mean,
Yeah,
a
why do you
lot
think
of
that's
things. I don't. I think a lot of our environmental things. Our foods don't have the stuff that they used to, mineral wise, nutrient wise, plastics, um,
plastics,
toxins in the
metals,
environment.
yeah,
Yes, yes.
toxins,
And you can
pesticides, all of
try.
it.
Right, right. Oh my gosh, I know. You could go. I literally, you could like
Yeah.
keep yourself up at night thinking about it. And you can try as much as you want. And I know you're really good at this.
I'm pretty good. I'm not perfect, but again, with the mold stuff, and I did take my moving from Chicago to Florida, like packing up your entire home and your work life and
Yeah, it's like
everything
a
is good.
cleanse.
Yeah, it's a good chance to be like, what do I really, and different
Yeah,
climates,
yeah,
right? So it's
right.
like, okay, well, I kind of need some different things. But yeah, it's just, I mean, you can take time slowly and, 1 month start going through your household
Yeah.
cleaning products. The next month, maybe go through your laundry products. The
Yes.
next, go through some of your skincare or even spread it
Yes.
out, more so than that. But it's like,
Right.
even down to the things like I know I've talked to you about a million times bamboo toilet paper. Totally
Yeah.
different than regular toilet paper,
Yeah.
But then
Yes.
even just filtered water can make a difference.
Yes. That's something we do in our house.
And
Yeah.
yeah, and sometimes toiletries that are in glass containers versus plastic,
Well, and I was just gonna say, like, for the women out there, men, Tupperware is a big one.
Oh, yeah.
So even and it's becoming more popular now, like with the cooking utensils or pots and pans being
Yes.
the chemical free, all of that stuff, I believe plays a part in these younger kids. And a lot of the younger guys in particular, which is kind of scary too, they're going the more, which we can talk about too, but like synthetic testosterone route.
Yes.
Where, which we don't do in our office, but they'll do, it's cheaper. And
synthetic version is cheaper.
Yes.
Versus
And so versus bioidentical. And so for them, it's a quick thing. It's cheap. They get their testosterone. They feel good. They do their weekly injections. They can work out like they were when, they couldn't before. So, and that's scary too, because that puts a lot of pressure, risk on the heart, and it's got a lot of side effects to it. But yeah, so earlier, I would say the earlier in general, the better, especially if you're symptomatic, I would get them checked.
Yeah. And maybe let's segue into the bioavailable versus, I always want to say, is it bioidentical, bioavailable?
We just say bioidentical.
Yeah, it's okay. I say both, obviously. But so I went and got my blood tested by you recently, and certain things more in depth because I had gone through a few rounds of freezing my eggs, TMI, but too bad, so sad for everybody else. But
Good for you.
Yeah, and then after moving too, it's just like, I needed to establish a new plan of care with somebody, and I went into the doctor, and I might know a little bit more than most, but I needed certain levels looked at of things that I had been tested in my blood for at least a year and a half, right?
Yeah, right.
Again, the testing I got back was so basic, even with advocating and asking, which really just pissed me off.
Yeah.
So
you have to beg them to check.
Yeah. Well, and I thought I did that,
I know.
And so luckily when I was visiting family outside of St. Louis, I've stopped and I actually visited with Kristy too. And so she helped me out and was able to take a deeper look. But yeah, it's really important. And something that I talked to her about too is with the egg freezing process, before I did that, they had me take synthetic birth control for a month.
Yeah. I did IVF too.
Well,
so we were talking about this. Yeah.
I even called my sister multiple times during that month. I talk about the insomnia and the anxiety and the racing thoughts keeping you up at night. I felt like so anxious, like I almost couldn't breathe. And I've never been like that.
Yeah. No.
Again, it was just something for me to go through. And luckily I was able to recognize like, okay, this is not my norm. This is probably
and it's temporary.
I'm taking. Yeah.
Yeah.
But it did make me realize like, oh my gosh, there's so many young people being just handed these out like candy.
I know.
And I mean, we were on a lot of those things.
Oh my gosh.
Too. And it's like,
for a year,
we had no idea, but it's like the effects that stuff can have on your body and just how it can change, your body's ability to produce its own naturally substances and whatnot too. There's an adjustment we did there.
We talked about this too. And again, this is just me thinking, whatever. But a lot of our generation is having a lot of fertility issues, myself being one of them. So I'm talking like personally too. And what you just said, a lot of us were on some kind of birth control, growing up, like whether it was the pill or whatever. Back then, wasn't it the Depo?
Yeah, there were so many things.
Yeah.
There's probably like a pill, a patch, a shot.
Oh, the arm
I don't
thing,
even know
the arm.
Oh, and there's like an implant.
Yes. Oh God, there's
a lot.
And but like, what did that
and it's
do?
prescribed for like skin stuff too,
for acne,
right? It's like when you start getting acne as a young teen, that's usually what's prescribed.
Or irregular periods.
Let's get you on a synthetic hormone, right?
No. Yes. And it's like, what did that cause for our dinner? Like, is that
who knows?
I don't know.
I don't know. Well, all I will say is what I do know is synthetic can feel very different in your body.
Yes. Well, yeah.
It was a wild ride for that month, and I could not wait to get off that ride. And I'm just very glad that I had the awareness around what was causing it, because then I could at least like bide my time and be like, okay, I only have like 2 more weeks left.
Right.
And then it'll be over.
Right. Yeah. So true. Yeah, that's a rough part. All those hormones, man. That's a whole different conversation.
It was not fun, you know? Okay,
Yeah.
so now let's switch to talking about libido, the thing everybody's quietly Googling
Oh,
every
yeah.
night and nobody ever wants to talk about in real
Oh, I
life.
know.
But, and this comes up with a lot of, our married peers even, so it's
Oh,
like people
gosh,
are
yeah.
going through it and maybe they talk about it somewhat in their private circles, but sometimes not medically, but there can be some
Yeah.
medical reasons here. So don't be
Yes.
ashamed, right? So how
Oh, yeah.
often would you say libido issues are actually hormonal versus relational or
Oh,
psychological?
yeah. Yeah, and I've seen both. So I would say, honestly, what I tell those patients, and my patients they open up to me. We get into the nitty
Oh,
gritty.
mine too.
Okay. So
Yeah, we get personal.
yeah, and I feel like I'm very close to my patients and I know them and they know me. Like it's two-way street. So I just tell them, I'm very upfront with them. When they come to me and they say, I don't care. Like, I don't care about having sex with my husband. I just want to go to bed. I,
Mhm.
they might say, like, I don't want him to even like touch me. I just want to read my book and
Yeah.
go to bed and whatever.
Mhm.
So I just say, well, I'm definitely going to increase you. We can definitely get that better. And then some of them say, well, I don't know if it's that or if it's our connection and our
Yeah.
relationship at this
Like, is
point.
it the person or is it
Right. Right.
yeah.
Right. Yeah. The chemical imbalance
Like,
or
yes, the
the
connection or
person
the
I'm laying
person.
next to. Yeah.
Yeah.
And I just say, let's fix that because I know I can fix that. And then you'll know. And it's true though. And most of the time, it's very rare, but that it's the opposite. But most of the time, it's hormones. And God love them. They come to me and they're like, not to like toot my own horn, but like, this saved my marriage. These hormones saved my marriage. We're having
Yeah.
fun again. We're going on dates. We want to have sex.
They're
And
yeah.
it's just fun. It's like it used to be. And they always say, like, I got myself back and I got my husband back. We're laughing. We're having fun. So yeah, it's a big one. Male and
Yeah.
female.
I was
Yeah.
just gonna say that too, because so for listeners, when I first started my business for myself, I worked for a year renting a room out of a functional medicine practice where I learned a lot. And also, luckily, perfect timing for my mold stuff. But yeah, it was not just the women were coming in, not just the men were coming in. It was both parts of the couple too
Oh
coming
yeah.
in for their separate appointments and
Yes.
and sometimes I would work with them on PT, maintenance stuff or whatever I was, working with them
Right.
at that time on. But it's like both parties would just talk about like, yeah, I feel so much better. I have more
Oh yeah.
energy, like I have more interest. So I picked up this new hobby.
Yeah.
It's
Yeah.
like it's not just
You're
the sexual
vitalized.
desire, it's
No.
your actual interest and like
Yes.
desire to even be in the proximity of anything or anyone else as well,
Yes.
right?
Yeah. And I get a lot so which I love. A lot of the times I'll start with one of the wife, husband, wife, whatever.
Right.
Or girlfriend, boy, it doesn't matter. But I'll start with one half of the relationship and then fast forward and it's textbook. Give it like 6, 8 months. Then comes the other one. And I love it because they're reconnecting, right? And they want to keep up with each other energy wise, their decline in drive, like all of that. They want to feel good, not only for themselves, but for their partner. And so they're growing closer together that way. And it's huge. And then a lot of my younger moms, especially, they're exhausted and they have
Yeah.
no energy. Their reserves are gone.
Oh, yes.
And then they start to feel bad because it plays on them. Like, the stress of not having sex with your husband. I mean, it does. Eventually, it's like, oh my God, this is not normal. And then you start feeling that guilt.
Mhm.
It's not him. I'm exhausted. I don't have it in me. I'm
Mhm.
my, whatever the reason might be. And then we replace those hormones and they're like, oh my God, thank you. Like now I feel like myself again. And my husband, we're reconnecting on that level. So it's a Oh, yeah. It's a big one. Big one.
So when it comes up, because as we talked about, a lot of people don't immediately recognize low libido as, a hormone
Yeah.
issue, but maybe if they are coming in to talk to you about that specifically, they are. But what kinds of other, let's say, physical symptoms might they notice along with it besides just the lack of
So,
clarity around the low libido?
yeah. So for my like postmenopausal vaginal dryness is a big one.
Okay.
So not so much with my patients that are younger, still having regular period, they're not going to have that typically.
Mhm.
I mean, it would be very rare because their estrogen is still good. Um, but yes, vaginal dryness is a big one.
Okay.
Um, as far as I mean,
What about for men?
um, erectile issues, decrease of morning erections is a big one. So on our symptom checklist for our males, obviously they're two separate checklists, male, female. But that is one that a lot complain of. They notice that early on. Their number of morning oh my gosh, number of morning erections is lower
Yeah.
than what it was prior to. Also, their ejaculation. They can't get there. They can't climax like they did. Their libido is low. So those morning erections for males is probably a good early indicator that something's
Yeah.
dropping. Like that should be pretty steady. And the minute
Yeah.
that it starts going down, that's when I would say you might want to get your testosterone checked.
Yeah. And then do you feel like before that point is usually when they would probably start reporting some of the other symptoms like you know, feeling past their peak or not being able to build muscle bulk or the
Yes.
inflammation and like some of the other physical
Yes.
stuff too?
Yeah. And they might not um connect those so much with low T.
Right.
So right away.
Yeah.
But then now the decreased morning erections that they
Exactly.
connect
And
that.
that's my
So
point is like I feel like people hear the word hormones and they think it just has this reproductive connotation, but
correct.
there's
Yes.
so many other roles
So
that
many.
hormones play in our body
So
than
many.
just reproduction, right? So that's why I just want to shed light on all of
Yes.
the kind of the spectrum of the symptoms. That way people can hopefully pay
Yes.
attention and make life a little bit easier for yourself, right? Because
Mm-hmm.
all these things are natural, like these things happen to us as we get older, as we age, as we transition through different phases of life. But
Mm-hmm.
we really can make the struggle a little less um, of a struggle,
Yeah.
basically,
Yeah.
right? Make it feel a little bit more easeful. And
Yes.
just by getting your own internal levels rebalanced in a natural, organic way, right?
Right. Yes. 100%.
It's just like
Mood
you
is a
wouldn't
big
go
one too.
without water for years to come, right?
Right.
You wouldn't
Yes.
because you
No.
couldn't. Your body literally
Yeah.
would not make it. But it's
Yeah. Shut
with
down.
other things like hormones, we're like, well, we're just, we are at a deficit, but that's just what it is. That's just our age,
I hear that all the time.
you know?
All the time. This is
Yeah. And
just
it's
what
like,
happens. This is what's
like,
supposed to happen.
okay, but,
Yeah. Yeah.
and
No.
for me on the physical therapy side of things, again, it's like I've worked with so many people over the years that have been kind of working throughout their bulk of their life to be able to enjoy their retirement with their spouse
Yes.
or
Yes.
travel and do all of these things. But if
Exactly.
you are unable to kind of keep yourself recalibrated in the meantime, then unfortunately, some of those things are going to feel a little bit miserable and a little
Yeah.
more difficult when you get
And
there.
right.
Yeah, or you're gonna have to take a serious pause to get your hormones assessed, to do the physical therapy,
But
to get all the medical stuff to get yourself primed before you can be free to go do those things,
yeah, it's so
right?
true.
So it's
Yep.
like it's just
I
please.
know. Yeah. And I get that all the time when you said like literally daily. They'll come in. Typically it's the females because they'll just women tend to just suck it up, right?
Yeah.
Um,
Well, and we
they
have a
take the brunt of
really
it.
yeah,
I
and
want
people may agree or disagree with this, but from a physical therapy standpoint, women have a really high pain tolerance, I would say. There's a few here or there that don't, but They do, and this has even been proven in research and, talking about hormones. There's all
Yeah.
these videos of period simulators out there, right? So this has nothing to say about
Flavors.
men, but what it is saying is women are constantly exposed to low levels of pain every single month, and the severity of that can
Right.
fluctuate. But basically, it happens, right? So we
Yeah.
kind of get accustomed to it. We internalize it. We're just like, again, same old part of being a woman. This is my
Yep.
cross to bear,
Oh,
right?
yeah. Yeah.
But
And menopause gets such a bad rep, right? So
yeah.
it's
Well,
just, I'm
and
going through the
perimenopause.
change. Oh, yeah.
Yeah.
I'm going through the change. This is what's supposed to happen. I'm supposed to feel like crap. No, no.
Yeah.
No. You do feel like crap, but you don't have to feel like crap. You
Yeah.
can change that. So, I
There's
literally,
options.
yes. Yeah. And they're not scary. And I get those questions all the time. Hormones have a bad rep too,
Mhm.
and hormone replacement does too. And so my job is to say, okay, like these are your labs, this is medically what's going on in your internal, but also all these symptoms, and this is how we can fix it. And I'm going to answer all the questions, you have about it and make you feel comfortable with it. But the women's health study that came out years ago, but that it scared a lot of women, and even women that at the time were on hormone replacement and feeling
Yeah.
amazing on them. And then, rightly so, their doctors freaked out over the study, discontinued their hormones, and then they were like, whoa, my gosh, I feel horrible again. And then from then on, it's just kind of, but now I feel like people are opening up to it. I'm getting a ton of patients coming to me like, I've been online, I've been Googling it, I've been researching these, I've been talking to my girlfriends or my sister or whatever. And they're so much more open minded to it, and they're seeking it, which is huge. There was the stigma with it before, and I feel like that's changing. So it's awesome. It's great.
Yeah,
Hope
I
it
feel like the
continues.
stigma is changing a bit too. And, maybe it's part of the circles that we're in the integrative kind of
I know.
holistic
Yeah.
based
I
communities,
know.
but I'm hoping that the stigma is changing.
Yeah.
And yeah, it's all about discernment and balance and making sure you go to a qualified provider. And again,
Yes.
asking the right questions, asking
Yeah.
about the bioidentical versus the synthetic,
Synthetic.
and,
Yeah.
and also understanding if it is something that's important to you, that sometimes, unfortunately, the way the world is right now, at least in this part of the world, some of those natural routes do cost a little bit more out of pocket
Yeah.
because it's not a business monopoly in that regard. It's
Yeah.
more so like something that's bringing your natural body back into balance, right?
And I tell those patients too, because cost, yeah. So our patients, it's cash pay.
Yeah.
Now I feel like we're very fair with it, um, our pricing, but it's a conversation I have with them. And a lot of the times I'll tell them, yes, I get it. Trust me. This is what it costs. Like there's no sugarcoating it. This is the price, but you might not need your Ambien and all of these millions of supplements that you had, what we were talking about initially, like no direction on, that you don't need these anymore. Okay, so cut that monthly cost out. Um, you might not need your sleep aids. Your testosterone could help lower lipid levels. You might get to a point where you might not need that anymore,
You
or you
might
might
not
not
need to
need
take
your
yeah,
antidepressant.
exactly. You
And
might
so,
not need to take 20 supplements. You can maybe take
right,
1 or 2.
3, yeah, exactly.
Yeah.
So, and when you kind of work through that with them, and I'll say, this script I can send here. It's cheaper. You can use your insurance. This, unfortunately, it's got to go to a compounding pharmacy or whatever it may be. But you can work through that. So what I would tell them is just find a practice near where you live. Find somebody that you can actually like have an honest conversation with like this
Yeah.
and just talk it through.
Yeah.
And then typically there's options, and I can cut out some stuff and maybe add stuff later if need be. But in the beginning, I would just focus on the hormones and the real supplements that you would potentially need. Like most of my
Specific to
patients,
your body.
yes, yes.
Yeah.
And how much, right? So some of my
Yeah.
patients, they need put my patients on typically a methylated complex B vitamin. And I might start them on it once a day, but then I tell them, I'm going to check your labs in 5 weeks and I'm probably going to get you to where you're in a maintenance. So yeah, it's daily now, which kind of sucks, but then you're going to get to like 2 to 3 times a week. And then that cost in itself will go down significantly too, because that 2-month bottle will last 4 or whatever it is.
Yeah. Well,
So
and people get supplement fatigue. I got it when I was going through the mold detox stuff. It's you get really
remember in your
tired.
apartment in Chicago, your door, the cabinet, it was like,
Oh my God, it was
stocked.
full
I'm
of
like,
supplements.
what is?
Yeah. And I mean, and the charcoal powder and
Oh, I know.
like I hated bringing it places because people be like, "What's that black liquid you're drinking?" And I was like,
Oh,
"It doesn't taste like
that's
anything. It's
charcoal.
fine."
Yeah.
But yeah, supplement fatigue is real, and it, you know, I mean, the cost of it is a lot, but
Good ones. Yeah.
swallowing all of that
Even
stuff,
the
it's tough.
bad ones are expensive.
Planning your meals around it is a lot because if you're taking your supplements properly, there are certain things you are supposed to take before you eat. There are certain things you're supposed to take with food because it helps the absorption. So again, if you
Right.
don't follow those parameters and time things out properly, then
Yeah.
you're missing out on some of the benefits and the effect. And I know for me with detox stuff, it was like sometimes I had to take stuff at one time, and then 20-30 minutes later, it was like,
Oh,
that's the
yeah.
time to take the next thing because then things have been purged from my cell through the binder, and it's like, oh my gosh, it's a
Good
lot.
luck relaxing. Yeah.
I
No,
know,
yeah,
but
it's a lot.
so it's just go, having discernment, go through the process the right way, at least try your best to do so,
Yeah.
and have the conversations at
Right.
least.
Right.
And yeah, hopefully you can just pare it down for yourself a bit and make it a little
Right.
bit more manageable.
Right. Well, and there's different kinds of hormones. So, different kinds of bioidentical too. So you can do creams, orals, gels, troche, like any patches, like any,
Mhm.
it can be compounded really any way you want.
Mhm.
What we do at our office is the pellet therapy,
Mhm.
which is becoming way more um, publicized. More people are asking us about it. Um, and the reason we do that is because it just works better. It's a more consistent dosing schedule. We can check a serum, a blood test, and I'll know exactly what level you are with like a topical. You would have to do like
Mhm.
a capillary or spit test things anyway. So that's why we do them. They just work better for the patient. It's more steady dosing, but there's options. So,
Yeah.
now they're typically bioidenticals are going to be cash pay, no matter what route you go,
Mhm.
where the synthetics, unfortunately, most of the time insurance will pay for parts of that, which is why another reason why some people are still doing the synthetic.
Doing the synthetics, yes.
Yeah. Wow.
Exactly. Yeah, and it's all a personal choice and for me, everything that I kind of do is around, I just want people to have the information, have the knowledge. As I explained,
Yeah.
I am by no means perfect in how I live my life, because I also want to enjoy it. I don't want to live
Yeah.
based on
Right.
restriction. So,
Right.
I mean, we all have these choices, and you can kind of sift through whatever it is that you have going on in your lifestyle and everything that's on your plate and kind of pick and choose your battles. But,
Yeah.
the how you're feeling battle doesn't have to be part of your day to day. Right?
No. No.
So,
There's hope.
exactly. So
Yeah.
then what does your process look like when somebody first comes in to see you or even virtually? What would you say that looks like for them?
Yes. So typically what happens is they'll come in for their first appointment, which is a blood draw.
Mhm.
So we start there. So we have them come in. We do our labs in house. So we'll draw their labs in the office. They'll set up an appointment with me to go over all of their labs, a lab review with them where I sit down face to face. Here's your copy. Here's my copy. And we literally start at the top and we work
Mhm.
our way through the whole thing. And then when they come in for that blood draw, they've filled out that symptom checklist that I was talking about. So I can see exactly what they're feeling. When I dose hormones, I dose typically 80% what my patient tells me, 20% labs. So that goes back to the whole lab talk. Like,
Oh, yeah.
yeah, your numbers here,
They
it's
play a role,
within.
but they're not the whole story.
Yes.
Yeah.
100%. And so we go over all of that. And then I just simply explain to them, here are your options. This could be causing this. Let's talk about inflammation, vitamins, things like that. And because in our office, we don't just replace the hormone because yes, that would help, but it's not ideal for the patient overall. So yes, so my hormone patients, I'm managing their hormones, I'm managing their thyroid, I'm managing their inflammation markers, I'm managing their vitamin B, vitamin D, all of those, homocysteine, all of those things. And then when we check labs and we do all those follow-ups, that's what I'm watching. And that's how I can tell how they're doing, how they're feeling, and optimize it better for them.
Yeah.
Because if I just gave them testosterone, well, sure, that's going to make them feel a little bit better,
Yeah.
but it's not going to address everything else.
Well, and something that I think that is maybe important to close with that you've mentioned and we've talked about before is, again, what you just listed, those are a lot of factors playing into hormones, right? That
Mhm.
all have an effect. But a lot of time when people think of hormones, they first, I mean, even when I would mention I need my hormones rebalanced with my mold detox stuff to my dad,
Yeah.
he would be like, and I was like, "Why are you getting awkward? Like, you have the same hormones in your body
Oh, I
too,
know, I
right?"
know, I know.
And he
Yes.
was like, "I'm not." He was.
Yeah. It's
So
like, this
it's
is
like,
uncomfortable. No.
yeah, like, we all have the same hormones, you know? So I
Oh,
guess,
yeah.
like, yeah, what would you say would be and some of the non-negotiables that you would want people to walk away with from today, you know, men and women in relation to hormones?
Um, well, the number one is testosterone. So testosterone is massively important. A lot of my patients, they just replace testosterone. So my females, they don't want to mess with estrogen. They don't have a lot of those symptoms. Yeah, their numbers might be off. Well, they're going to be, but they're not feeling it physically.
Mhm.
So fine, let's just go with testosterone. It does wonders. And the reason is it's a natural anti-inflammatory. So any arthritic pain, inflammatory pain, muscle aching, cramping, muscle fatigue, my autoimmune patients. So like my lupus, RA, all of the, oh my gosh, it's Crohn's even, like
Mhm.
it's so beneficial. It prevents Alzheimer's and dementia, cardioprotective. And when I'm talking about this, I'm talking about bioidentical testosterone
Yes,
because
not
the
the
synthetic, no,
that could be a different story. Yeah.
totally different. Yeah. So yeah, that would be huge. Research testosterone, get to know your testosterone level, look at your symptoms, and then compare and contrast because
Yeah.
I have not seen one normal testosterone level, male or
Mhm.
female. So
Yeah.
yeah. And a lot of women don't even know they have testosterone. They think it's just men.
And a
And
lot of
it's
men don't think
not.
they have estrogen either.
Yeah.
You
Yeah.
know?
I know. Yeah, that's another one. So my
Exactly. That's
males,
what it's like,
yeah.
"Excuse me, dad, you
I
have
just had
them
that
too."
conversation with a patient on Thursday.
That's
And it happens all the time. They have undetectable estradiol and low testosterone. Well, which makes sense because testosterone for males, obviously, it aromatizes or breaks down into estrogen. But if they don't have that testosterone, they're not going to aromatize. You know, their body's going to save what they can. They're not going to aromatize it.
Mhm.
But estrogen is so important. Bones, mood. So yeah. Yeah. Anyway, so
Well,
yes,
and something
testosterone.
important to note and point out is that we did not talk about really cortisol at all today, but I feel like in the media, people think hormones and they think, oh, if I want to affect my hormones, I need to get my
Yeah.
cortisol checked. That's a pain in the butt process to go through um, and
Very
a very
expensive.
extensive, long process, and
Yeah.
sometimes not even all that accurate still at the end of it.
Yeah. Right.
But otherwise, again, everything that Kristy just mentioned of all of the different factors that play into your hormones, those all affect your stress levels, which ultimately are tied in with cortisol.
Cortisol.
So
Yeah.
cortisol is not the main player here.
I get that
It's usually the
question.
other ones.
Yeah. I get that question. Oh my gosh. Like every
Yeah.
day. Why didn't you check my cortisol? Well, and what I say to them is, well, to do it correctly, you need to do a spit test. So you would have to do like a time, and you know this, I think, right? You've done this before. So you have to do a timed spit test, and it's
I don't even think I did the timed one, but I know of the test.
Yeah.
And there was a
And
point where I actually almost got it for my dog because she had
Moldy?
doubled her size. Yeah, because she also had mold toxicity. And she had it probably worse than me, you know, she's closer to
Aw.
the ground. She was home all
Yeah.
day because I was at least
No.
leaving for work. So
Yeah, that's true.
hopefully we did not go through
Did you
that.
do it? Oh, okay. I'm like,
No,
oh my
because
gosh.
well, and for dogs, it's even less accurate because
Oh,
if the vet is already a stressful experience or like
oh,
sticking any
that's
type of
true.
testing thing is already
Yes.
stressful. So
Yes.
then if you're stressing them out
Yeah.
every time you're
Yeah.
collecting a sample, that kind of defeats the purpose.
Yeah. Null and
Right?
void.
Yeah. So it's just whatever.
But yes, I get that all the time. And so, and we don't test cortisol. Because I tell them cortisol revolves around all of those other, right? So if I can normalize your testosterone, your estrogen, your progesterone, which we do, inflammation, B, D, thyroid is huge. So if we manage all of these things, cortisol falls right into track.
Yeah,
You're
follows in
sleeping
growth.
better, your mood's better, you're handling stress better, all of those things. We don't need to check. We can manage it. So that's just now you can get it checked,
Of
but
course.
yeah,
Just know, I guess, what you're signing up for and that it's going to be a bit more of an extensive process and it's still not going to be the whole story. And
correct.
there will be other
Well,
things
yeah.
to look at
So you
that
get
will
it
probably have
tested.
a bigger factor.
Correct. So you can get it tested, but then more,
Yeah.
right? So you need to still manage all of those other things. So, but yeah, it's everybody asks about cortisol.
Exactly. So I just had to ask that as the last bit. Well, huge thank you for talking with me
Oh,
today.
thank
And
you.
please
This
tell
is so fun.
everybody where they could find you. And obviously, I mentioned you're out
Yes.
of St. Louis, but
Yes.
sometimes you do have clients from elsewhere as well.
I do. Okay. So, my practice is, I work at Simply Health Integrated Medical. We are in Town and Country, Missouri, so a suburb of St. Louis. And our website, where you can get all of the services we offer information, but it's simplyhealthintegrated.com. And yeah, it's awesome. I love it.
This is one of those conversations you can't unhear. And honestly, that's good because I'm just tired and this is just getting older doesn't have to be your story. Just because it's common doesn't mean you have to live with it. Knowledge is power, and now you have more of it. That's all for today.